Hello, I'm Dr. Jim Hotz, and I'd like to welcome you to Albany Area Primary Health Care, a truly remarkable organization I helped start 40 years ago. We've made the difference in people's lives. We've seen over 3.5 million people since we started, and they're our friends, our neighbors. We make a difference in people's lives, but it's all done because of the hard work of people like yourself. Our staff, our physicians, our clinicians. We bring people into this wonderful organization and try to make their lives better, try to get them to live longer, try to become more productive. And we welcome you here for this wonderful challenge. We came from very humble origins, started with just 2 physicians almost 40 years ago, but Albany Area Primary Health Care has continued to grow, and the reason for that is we've steadily responded to the needs of our community. We've been there through floods, through natural disasters, through biologic disasters like HIV. We've been there to solve the problems of our community and respond. And where are we headed? I think we're headed to become one of the largest primary care providers in our part of the state. Community health centers nationally have had an explosion because they have been the people there that have made a difference and are the only people that really change the cost of health care and improve the lives of health care. So I think you get the opportunity to join a really remarkable organization that has an unlimited future. Albany Area Primary Health Care was founded 40 years ago when a historically black college, Albany State, and Miriam Worthy from Albany State and Dr. Billy Black came together with local politicians from Lee County, who was Ida Chambers, whose husband was on the county commission, the mayor, Hopkins was on this, Keith Culpepper, city commissioner. They united with the citizens from Dougherty County, from Baker County, and it was a very unique coming together because you had rural and urban, black and white, willing to overcome and overlook their differences and saw what they had in common. And their common goal was to develop a unique system of care that provided primary care access for the people in our region. Well, what is a community health center and why is it different from other physician groups? Well, number one, our community health center is owned by our patients, which is very unique in the whole substructure of the way health care is delivered. So we get into areas that may not make us the most money, but make us a difference. We've been involved in school-based clinics. We were the first rural HIV program in the country. We've been involved in research efforts. We've helped start a family practice residency program, an AHAC, and been involved in a number of other activities, such as during the flood of 1994. We were one of the few providers in these rural communities. We flew over 550 missions in helicopters to take care of people who are isolated and no other source of care. So what makes us different is that we're there for our patients, rich or poor, in sickness and health, till death do us part. It's a commitment that most physicians aren't willing to make, and it's one that we proudly take on. What do I want employees to remember when they take on patients or somebody comes to visit us? When I started this organization along with the community groups, the vision was that be a place that I would feel proud for my family to receive their care. And I'm proud to say that every one of my 4 kids were taken care of by our pediatricians, grew up in our system. They're all doctors now. And they say it was pretty remarkable that you would be in the waiting room and you'd see people from all different backgrounds. So I think what makes us really different is that we've got an open door policy for everyone. And the belief was when we started, if it's not good enough for you and your family, shut the thing down. So we want everybody and every employee to think and treat them just like it's your own family. Is the essential part of what we do. Antonio Novella, the first Hispanic Surgeon General, said, "People don't care how much you know until they know how much you care." In 1926, Francis Peabody, who was one of the first oncologists in the world at Harvard, said the most important aspect in the care of the patient is caring for the patient. What we want you to do here is to treat everybody like it's your family member and truly care for them, because it's until we develop that relationship with the patient that they realize that we are caring for them no matter what, that we get our best results. So it's by that connection with the patient, the relationship we develop, that we really make a difference. Is that we're kind of the Marine Corps of the healthcare business. We go places nobody else wants to go. We establish beachheads with populations that nobody else wants to take care of. And why do we do that? Because we touch people that nobody else wants to touch. We go to communities where the economic base cannot support the private sector of medicine. We provide outstanding health care for everyone. So the job we take on is a little bit more of a challenge. The markets that we try to penetrate are not the ones that are driven by classic economies, they're driven by community needs. Why else would we be in school-based clinics? Why else would we developed one of the largest rural HIV programs in the country? Why else do we get involved in research projects? Because we want to make a difference. And we're proud to have you join the commitment to make a difference for the communities we serve.